Hello, thank you for your introduction. My name is Dongwoo and I'm an associate professor at Kyung University, the College of Korean Medicine. I specialized for acupuncture and moxibustion medicine, and today I would like to introduce to you the basic concepts of Korean medicine. Well, this is my profile. As you can see, I'm an associate professor, and my clinical specialties are spine and joint diseases. As academic society activities, I am Director of General Affairs at the Society of Korean Medicine and the Korean Medicine Spine and Joint Association. Also, I am the Director of International Affairs at the Korean Society of Acupuncture and Moxibustion Medicine. Well, these are the contents I'll be talking to you about today. So I would like to introduce what Korean medicine is and the main theories of Korean medicine and the clinical applications of Korean medicine and the recent trends of Korean medicine. First, what is Korean medicine? Well, the Korean medicine is one of the traditional medicine systems of Korea, and it is influenced by the East Asian traditional medicine systems. The traditional Chinese medicine, Indian traditional medicine, Japanese Kampo medicine, Vietnam, and East Asian medicines have influenced each other. Well, although it starts from the same root, maybe based on the Eastern science or Eastern Oriental philosophies, it has changed and evolved into a unique medical system. It has been more localized and more specialized for each diseases, which are more abundant in Korea. So what is the difference with the Western medicine? Well, there is a different scientific approach for Korean medicine. If the Western medicine focuses on the cells or maybe biochemicals, we would focus on the whole body or the harmony of the body. So the approach may be a little different. So, and because these scientific approaches are different, there is a lack of well-designed RCTs based on the Korean medicine systems. For example, we have studies that study acupuncture effects or maybe herbal effects, but they recruit the patients based on Western diagnosis and they evaluate the patients using the Western evaluation tools. So we need to develop a more specialized study method for Korean medicine. Also, there are various diagnosis systems and various treatment methods in Korean medicine. Well, among the interventions used in Korean medicine, the most popular would be the acupuncture. I think most of you are already familiar with this. We use acupuncture needles to stimulate certain acupuncture points to have some effect. Also, you could use it on muscles or tendons also. Traditionally, we had 9 different acupuncture needle types. You can see that some of the needles are almost similar with the acupuncture needles used today, but some of the needles seem to be similar more to the surgical masses or surgical knives. So in the past, the Korean medicine doctors not only used acupuncture, but also did simple surgical procedures. Nowadays, the acupuncture needles have been developed and more modernized. You can see there are various types of acupuncture needles we use today. This is an example of a laser acupuncture. This is an example of a acupuncture that is used for single penetrations, and these are sticker acupunctures that can give more long-term stimulations, and these are needles for acupotomy, where we cut through the soft tissues or maybe tendons and ligaments to reduce the pressures. Also, there are pharmacopuncture, where we use herbal medicines as injections, and more needles that can be used to stimulate a more broadened area. Also, we use electrical acupuncture. In traditional times, we would use only manual stimulation, but it was hard to standardize the stimulation. So by using the electrical stimulations, we could standardize it and be more convenient. Also, these are examples of ear acupuncture or sticker acupuncture. We put the acupuncture needles into the skin and then leave it there for about 3 or 4 days, so the patient can massage the acupoints, so the stimulation will be more long-term. Also, there's the fire acupuncture, where we heat up the needles to give heat stimulation and also the physical stimulation of the needle at the same time. Also, we can put moxibustion on the acupuncture needles to put in heat stimulation together with the acupuncture needle stimulation. Also, there are tools that we can use for acupressure, so that if a patient is very scared of the penetrating the skin, then we would use these massage tools to massage the acupuncture points. Also, there are needles for bloodletting. So bloodletting is another intervention we use commonly in Korean medicine. These are examples of moxibustion, where we burn moxa cones, and the heat stimulation onto the acupuncture point will stimulate the circulation of the ki of the body and also the blood circulation of the body. Also, many of you may have experienced this cupping therapy, where we put cups onto the skin surface to make a pressure stimulation to pull on the skin, so it can promote the circulation of the body. Also, we use many types of herbal medicines. The herbal medicine focuses on harmonizing the body and balancing the body. So based on each patient's symptoms and maybe the constitution of the patient, the herbal medicines may differ. Traditionally, we used a lot of decoctions or maybe soup type medicines, but nowadays we have a lot of new forms, so we could use it as capsules or pills, or also powders and so on. Also, there's the Chuna therapy. So it's a manipulation on the spine to modify the structure of the body, so it may release pain and also modify your body structure. Also, who can practice Korean medicine in Korea? In Korean medicine, we have a unique medical system. So we have the Western medical system and also the Korean medical system independently. So in Korea, there are 11 Korean medicine colleges in private universities and 1 national graduate school of Korean medicine. And every year, about 800 new Korean medicine doctors are licensed through the Ministry of Health and Welfare. For the 11 Korean medicine colleges, we adopt the 6-year education program. So it's the same with the Western medical schools. We have 2 years of pre-med and 4 years of medical studies. And for the 1 national graduate school of Korean medicine, they adopt the 8-year education program. So you would have to graduate from a biomedical or maybe biological college for a 4-year course, and then you would go through the 4-year course of Korean medicine. Currently, there are about 234 Korean medicine hospitals, and there are more than 13,000 Korean medicine clinics in Korea right now. And as for health policies, the various treatment methods of Korean medicine are partially covered by the national health insurance, and also they are partially covered by private health insurances. I believe that this is also true in the States. Well, the most representative figure of Korean traditional medicine will be the Dongwoo. This traditional text was adopted as the UNESCO's Memory of the World program. So it consists of Korean medicine theories and also the clinical applications of Korean medicine. And also in Korea, there's a unique medical system called the Sasang Constitution medicine. So based on the traditional text, we would classify the patients into 4 major groups based on their body structure or their characters or their symptoms they would experience in daily life. So it has a more tailor-made medicine aspect. Also, not only do we adopt the herbs introduced in the Chinese medicine, but we also had to localize our medicine system because some herbs are very hard to get supplies in Korea. So more local herbs were adopted into the traditional medicine system. So we get a lot of people ask us what the difference is with traditional Chinese medicine or the Japanese Kampo medicine. Well, maybe the traditional Chinese medicine, they adopt the Western diagnosis, and then based on the Western diagnosis, they would use the Chinese treatment methods. As for Kampo medicine, because in Japan, only the Western doctors can prescribe the Kampo herbs, they emphasize on the symptoms, and then based on the symptoms, they would prescribe the Kampo herbal medicines. But in Korea, because the Korean medicine doctor is a whole independent system, we could diagnose patient based on the Korean medicine theories. Also, we don't emphasize only on the treatments of the disease, but we try to focus on the treatment of the body. So it has a more preventive and more integrative character compared to TCM or Kampo medicine. So I would like to introduce to you the main theories of Korean medicine. Because the main theories are very complicated and very deep, it may be difficult to make you understand the whole thing in a short time, but I would like to just introduce to you the basics. The main theories of Korean medicines are the Eum-Yang or Yin-Yang in Chinese, and also the 5 elements theory or the Meridian Theory and the Sasang Constitution theory. And Yang is the basic theory of looking at the nature and classifying the natural phenomena. So we could divide the whole universe into 2 parts. There would be the dark part and the bright Yang part, and these 2, Yin and Yang, will circulate. And also you can see that the has Yang in itself, and also the Yang has the in itself. So they have to be harmonized and always balanced. For example, if the heaven is the Yang, the earth would be the and if the sun is the Yang, the moon would be the So these opposite concepts all can be classified into and Yang. And based on this classification, we could classify the patient's symptoms, or maybe the patient's structure and the diseases based on the and Yang theories. So by classifying them to the or Yang, they will be treated for the harmonization and also the balance of the and Yang. Also, a major theory would be the 5 elements theory. You could see that the universe is consisted of 5 major elements: the earth, the metal, the water, the wood, and the fire. And these 5 elements would influence each other and always control each other. For example, where there is earth, you can unbury metal, and when there is metal, you could see that water is produced when the metal is put into the air. And where there is water, wood or plants can be grown and nourished. And when there is wood, you can produce fire. And the fire is the center of the earth, which is like the energy or the lava. So you can see that each 5 elements can nourish each other, and at the same time, they can control each other. For example, if you have fire, you could use the water to turn out the fire and control it. And where there is water, you could cover it with earth, so it will be controlling the water. If you have wood, the wood would grow from the earth and sometimes break the soil or break the rocks. So you can see that the wood controls the earth, and if you use metals as like axes, then you could cut the wood. And if you have fire, you can melt the metal. So these 5 elements control each other at the same time. And all the organs in our body have the characteristics of each 5 elements. So based on these classifications, we could see which aspect of the body is imbalanced, and we could try to modify the balance in the body. And then there's the Meridian Theory. If our bloods flow in the arteries or veins, there's another channel where our energy or the vital energy flows. So the channel of the vital energy would be the meridians. You can see that the meridians are connected to different organs and different parts of the body. So based on what organs they are connected with, it will be the meridian for each organs. So if you have a disease in a certain organ, the symptoms or signs will show on the meridians, and also we would use acupuncture points on those specific meridians to control the disease of specific organs. And the Sasang Constitution medicine, as I introduced to you before, we would classify the patients into 4 major classifications, constitutions. So based on this, even though they have the same symptom, the treatment will be different. For example, if a patient has a dyspepsia, it might be that their stomach or their spleen is very weak from the start, or for some people it would be that they ate too much, or for some patients it would be because they eat too fast. Maybe even though the same symptom, the reason for the symptom will be different. So based on those classifications, we could use different treatment methods or herbal medicines and also acupuncture points for each patient. So it has a more tailor-made characteristic. In Sasang Constitution, they would divide the person into 4 major parts: the head and neck part, the chest part, the abdomen part, the pelvis part. So based on this classification, based on which part of the body is more developed according to each patient, we could divide the patient into a certain constitution. For example, each part of the body would be represented by each organs. The top part would be the lung, the upper part will be the spleen, the lower part will be the liver, and the lowest part will be the kidney. So based on each Sasang Constitution, you have a strong, certain strong organ and a weak organ. So these are the examples of the imbalance of organs based on the classification of Sasang Constitution. So not only do we treat the symptoms or the disease, we would have to try to control the imbalance of each function of the body they already have. So this is one of the major characteristics of Korean medicine. And you can see that the patients are divided into 4 groups based on their which organ is hyperactive and which organ is hypoactive, and also their characters or body shape and healthy signs and so on. For clinical application, I would like to introduce to you what I do in my clinic. So our university clinic has both Western medicine department and also Korean medicine hospital. So we would summon up both Western diagnosis and also Korean medicine diagnosis at the same time and try to plan which treatment would be best for the patient. So we could use many different interventions, which I will introduce to you later. And also, traditionally, we would only observe the patient or maybe listen to what their chief complaints are. But nowadays, we try to standardize the Korean medicine diagnosis. So we use a lot of medical devices to check up the patients. One would be the Yang. So it measures the electrical resistance of the skin, which represents the 12 meridians. So we could see the balance of each meridian based on the Yang test. So this is an example of a result sheet. So it will show how the balance of the each meridian is, and it would propose to us which acupuncture points we should use, or maybe what kind of Korean medicine diagnosis we could take into reference. But this is not absolute, so the practitioner would have to make the final decisions and the diagnosis. Also, we have the pulse analyzer. So we not only focus on how fast the pulse is, the frequency, but also the size of the pulse or the strength of the pulse and the position of the pulse. So based on the pulse analyzer, one of these are the result sheets. So we could compare it with the normal pulse shape and predict what the patient has in problems. Also, we use a lot of digital infrared thermographic imaging. So we could find out which part of the body is experiencing malcirculation, or sometimes which part has a red spot, which may be reflecting inflammations or maybe tensions of the muscles and so on. So we could find out which part of the body is imbalanced. For example, this patient has a very stiff neck and also stiff low back pain area. So we will try to target these areas for acupuncture treatments. Also, we have a Sasang Constitution questionnaire where we give the patients questionnaires to divide them and classify them according to the Sasang Constitution. Also, we use a lot of moire tomography, so we could evaluate the structure of the body and the balance of the muscles and also the spine. This is an example of a patient. You could see the imbalance of the both sides of the shoulder. So to modify this, we may use acupuncture or maybe Chuna therapy and so on. And also we have the blood stagnation analyzer, which is based on ECG and blood pressure. So we could see how the circulation of the blood is in each patient. Also, we use Western medical X-rays, MRIs, and sonographies to take into reference. So when a patient comes, we try to make them understand about their disease and their problems, and we would try to explain what our targets are. For example, if a patient has intervertebral disc herniation, the first target of the treatment will be to control the pain and also control the inflammation in this area. And then the next step of the treatment would be to loosen up the ligaments which are holding the spines together and increasing the pressure on the intervertebral discs. So we would try to loosen up the ligaments, and then we would try to strengthen the muscles, erector muscles, so that the muscles can support the pressure and reduce the pressure on the disc. And then finally, we would try to control the weight. So if they lose weight, it will help them bear the weight on the herniation. So In order to control the pain, we would use acupuncture or bee venom acupuncture are the most popular intervention methods. In Korean medicine, if a channel of the meridian is blocked and there is a malcirculation of the qi, this would result into pain. So in order to relieve the pain, we would try to modify the circulation of the meridian. And as for bee venom acupuncture, it has the effects of all the moxibustion, acupuncture, and cupping at the same time. And also there would be the chemical effects of the bee venom injection. So the bee venom injection has anti-inflammation effects, and also it controls the immune system and enhances the immunity, and also it can have effects on the nervous system or the hormones of the body, and also itself has a painkilling effect. So when we apply bee venom acupuncture, we would penetrate the skin. So the skin penetrating the acupuncture points would be the effect of the acupuncture. And when we inject the bee venom, heat will be produced. So this may be a kind of moxibustion effect. And at the same time, because of the swelling, it will pull on the skin and make a pressure on the skin. So this may be similar to the effect of cupping. And also we use a lot of electrical acupuncture to control the pain. And also we use a lot of moxibustion to reduce the pressure and also soothe the muscles, and so to control pain. But because we need to make a ventilation system, nowadays we use a lot of smokeless moxibustions, which are in forms of charcoal, so there's no smell or no smoke in your clinic. Also, we use herbal medicines that can control the pain and also enhance the circulation of the body. And also, when we are targeting to control the muscles, we would use the acupuncture needles. Sometimes if you use the acupuncture needles on the muscle fibers, it can strengthen the muscles. And if you use the acupuncture needles maybe perpendicular to the muscle fibers, it can also loosen the tension or loosen the pressure of the muscles. Also, moxibustion enhances the circulation to the muscles, so it can help reduce pain and also strengthen the muscles. The cupping is also used for releasing tension on the muscles. And sometimes we would teach the patients Tai Chi to strengthen their muscles. And this is a type of embedding therapy where we use surgical threads embedded into the body, and it will be absorbed totally in 3 months. But during the 3 months it's embedded in the body, it will give a stimulation, so it can help strengthen the muscle fibers. We have various sizes and various thicknesses, and you can see that we use these kinds of needles. The main purpose will be to strengthen the muscles here, the erector muscles. So basically we insert the needles here to stimulate the erector muscles. This is an example of embedding therapy, and the embedding therapy is also used, very popular for cosmetic uses also. To loosen up the ligaments, we would use traction so that we could stretch the ligaments and reduce the pressure on the intervertebral discs. And also we used acupunctomy, which is a more thicker acupuncture to cut into the ligaments and also the soft tissues to reduce the pressure. Also, to treat the degenerative changes, we would use herbal medicines to strengthen up the patient so that the degenerative change will be slowed down. So these are various forms of herbal medicine we use nowadays. As I introduced to you before, maybe capsules or tablets and also powders. And to straighten up the alignments, we would use manipulation therapies such as Chuna to modify the structure. And to control weight, we have certain herbal medicines that can control weight and enhance the metabolism of the body. These herbal medicines are also based on the 5 element theories. So we're short of time, so I will just introduce to you simply. Also, we have a unique acupuncture system called the Sam acupuncture. I don't think we'll have time to go deeply into this, but basically it is acupuncture points that has the characteristics of the 5 elements. So based on which meridian the acupuncture points are and which character it is classified into, we could choose the acupuncture points to enhance certain meridians or certain organs, or maybe to sedate the excess of each one certain organ. For example, if the liver is the wood and the liver has a deficiency, we would try to tonify the mother and sedate the controller. So when we weaken the controller will be less influence on the wood. So we try to control the controller and tonify the mother. So the water is the mother of wood, so we would use the water point of its own meridian and also the water point of the water meridian to enhance the mother. And to sedate the controller, because the metal controls the wood, we would choose the metal metal point on its own meridian and also the metal point of metal meridian to control the controller. So you could see this is the summary of the Sam acupuncture, and these are how we apply Sam acupuncture for deficiency. And in Korean medicine, recently we are more specialized. So now we have 8 specialized departments, just like the Western medicine system, and you could see many disease-based centers or clinics in Korea. Some of them are spine and joint centers, and you could see that many hospitals are specialized just for spine and joint centers. And there are a lot of facial palsy patients who receive acupuncture in Korea. So there are various facial palsy centers. And in Korea, if you have stroke, the patient would have a tendency to visit Korean medicine hospitals more often. So the acupunctures are very effective in controlling stroke. And also there are many cancer centers and women health center based on the Korean medicine. So many Korean medicine hospitals have this. And also in Korea, the parents are very competitive. So they want their children to be perfect and very strong in every aspect. So we also have growth clinics where we help growing the children very tall. And if you go to the Gangnam area, there are many Korean medicine beauty clinics nowadays. So it's very natural and safe and enhances the health and the beauty at the same time. Also, we have smoking cessation clinics where we use auricular acupunctures to control the smoking habits. Well, this is all I have to introduce to you today, and I'll take questions later after next session. Thank you.